Welcome to Community Health Matters. I'm your host, Kristen Presall. Poisoning is the #1 cause of injury-related death in the U.S., and anyone from infants to adults can be a poison victim. Josephine Darwin joins us from the Tennessee Poison Center to talk about poison risks and prevention, and what to do in case of a poison emergency. More than 123,000 men, women, and children currently need life-saving organ transplants, and every 10 minutes, another name is added to the list. Dawn Benjamin, Senior Public Educator Coordinator from Tennessee Donor Services, is here to discuss organ donation and transplants. More than 24% of Tennesseans smoke, which is much higher than the national rate of 18%. Marcella Bianco joins us from the Tennessee Department of Health to talk about the importance of reducing tobacco use to improve your health and resources to help you do it. All of that coming up next on Community Health Matters. Did you know poisoning is the leading cause of injury death in Tennessee, surpassing motor vehicle accidents, gunshot wounds, and drownings? Everyone from infants to older adults is at risk for accidental poisoning. The Tennessee Poison Center's specialists are available 24 hours a day, 365 days a year, and serve all 95 Tennessee counties. For immediate first aid treatment advice or information about poison prevention, call the hotline at 1-800-222-1222. Did you know the third week of March each year is designated as National Poison Prevention Week? Take time to safeguard you and your loved ones by saving the Poison Help Hotline number in your phone and posting it in your home. Secure all medicines up, away, and out of sight, and safely dispose of expired or unneeded medications. Install and check carbon monoxide detectors in your home and keep small button batteries and all cleaning products stored out of reach of children. For more tips, visit tnpoisoncenter.org or call the Tennessee Poison Center at 1-800-222-1222. Welcome, everyone. We have an eye-opening statistic to start today's program with, something everyone should know, and that is that poisoning is the #1 cause of injury-related death in the U.S. And here in Tennessee, it is problematic as well. Joining us today to talk about it is Josephine Darwin. She is the Director of Community Outreach from Tennessee Poison Center. We're so glad you're with us.
Thank you.
Thanks for being here. For folks out there who might not be familiar with the Poison Center, talk a little bit about it, what you all do over there.
Okay. Tennessee Poison Center is a comprehensive poison resource center that's based at Vanderbilt University Medical Center here in Nashville. But it does serve every single resident in all 95 counties. And we're the only poison control center in Tennessee, and the programs that we provide to everyone from the youngest child to the oldest adult are the Poison Help Hotline, which is what we're known for, and that's a toll-free medical hotline for poison emergency and information calls, and that number is 1-800-222-1222, lots of twos in there. And we also provide poison prevention education. And we also provide, this is something that people do not know the Poison Center does, 24-hour surveillance for chemical or biological terrorism for every county.
And so that's something that, you know, our nation's capital is aware of, obviously, whatever's going on here in our state.
Right, and that is why the 1-800-222-1222 number was first started by Congress in 2001, and that's one number that everyone in the United States can call to get their local poison control center. If we ever do have any kind of disaster, then everyone will call that number to get decontamination information and information on what to do in case of emergency. But mostly everyday emergencies is what we deal with.
All right. Well, let's talk specifically about that hotline, Josephine, because a lot of people might be familiar with it. For those who don't, we'll be putting it up throughout this program. But let's talk about who they are talking with on the other line. Are these volunteers? You had said medical staff, so let's talk specifically about that.
Okay. A lot of people feel that the Poison Center are volunteers, maybe medical professionals, but volunteers who come in and answer the calls, but only very qualified medical professionals who've had extensive poison management experience can answer the hotline. And these are full-time staff of the Poison Center, not volunteers. And you have to be a registered pharmacist, a nurse, or a physician to answer the calls. All of the specialists that we have right now are pharmacists and nurses, and we do have one physician, and then we have a board-certified medical physician toxicologist who provides medical backup 24/7.
Okay. And talk a little bit, if you will, about the number of calls that are received on the hotline. And
Sure.
if there's a reason maybe why they peak in volume or
Okay.
not, whether it be summertime or something like that.
Well, last year we had over 50,000 initial calls. Our specialists answer between 150 and 200 calls every day.
Wow.
From all 95 counties.
Okay.
We made about 49,000 calls to monitor the patient to try to keep them at home rather than them having to go to emergency rooms. So when someone calls the Poison Center, they'll get one of our specialists, they'll evaluate the situation, and then in 68% of the time, they will tell the person first aid treatment recommendations to do over the phone so they don't have to go to a hospital or to a physician's office. And that not only will save a lot of lives, but it also saves a lot of money.
Sure. When we're talking about specifically who is making these phone calls, or maybe who the victim might be, do you all monitor in terms of we have more children that we treat and help, we have more adults, and who would that be? Who is the primary victim?
Well, the most likely poison victims are, of course, children, because, especially children under 5, because they're exploring everything, and if parents don't put things up in a high locked cabinet or in a container where children can't get it, then they're bound to do that. So around 58% of our calls are for the accidental poisoning of children. But teens and young adults are the ones that are most likely to die from poisoning. And not only is poisoning the leading cause of injury death in the U.S., it's also the leading cause of injury death here in Tennessee, above motor vehicle accidents, gunshots, wounds, and drownings.
All right. Let's talk also specifically about the nature of the calls. Would you say the majority of them are serious? Are they emergency type situations? Or do people call really for information if something's ingested and they're able to maintain some calmness and get through it?
Well, the one thing that we recommend is that if you think you have an emergency, if you think somebody's been poisoned, to call the Poison Center first.
Okay.
Call the Poison Center first before you do anything. Don't call, if you call a pediatrician, they're going to tell you to call the Poison Center.
Okay.
But do that first, and then we'll tell you if there's a problem. As I said, about 68% of our calls were managed at home, so we were able to keep the patients at home. But if we do feel like you need to go to a hospital emergency room, we will refer you there. We'll call the hospital and tell them what to expect, and then we follow up with the patients at the hospitals also.
Oh, very good.
And that brings up something. It's not just the public that calls us, but hospitals all over Tennessee call us also.
Really?
Emergency medicine physicians are experts at a lot of things, but we are the absolute experts in poisoning.
Sure.
So if they have a overdose patient, someone who might have taken a lot of different poisons, then they will call the Poison Center for protocols and what they should do for those patients.
Wow. You touched on this just a little bit, Josephine, but tell us what the most common causes are of poisonings.
The most common is pain medicines. That's the most common thing that we have. Also, household cleaners. That's always a big thing. Cosmetic and personal care products, not only with children, but we've had a lot of adults who've brushed their teeth with hemorrhoid cream, thinking that it was toothpaste. So
really?
We have a lot of
so
different
accidental
things.
type scenarios.
Yes,
Yeah.
so many different things. We have plants. That's another big one, especially in the springtime and that includes pesticides, when people start putting pesticides out.
Makes sense.
So every type of poisoning we deal with.
Okay, let's talk about the prevention of this, because obviously, as you said, some of these things are going to be accidental. Some people, have chemicals in their household that, other members of the family may not be aware of too.
Right.
So how do we prevent poisonings from happening?
Well, the most important thing is to have the number for the Poison Center available and in your cell phone. A lot of people might have our stickers or magnets, but right now the one thing that most people have with them all the time is that cell phone. And so we want you to put the number, the 1-800-222-1222 in your cell phone. Also, anything that's a potential poison should be, if you have children that come into your house, should be in a high locked cabinet. That's one of the most important things to do, especially medicines. When we were talking about peak calls, our calls always go up around Thanksgiving, Christmas, holidays when children might be visiting grandparents.
Yes, extra family members are in the house.
And they
That's
have not
right.
put up their medicines. If you have caregivers in the house, you need to be sure that they're aware of poison prevention tips. Also, A lot of people will poison-proof the inside of their house, but they forget about the garage. There are a lot of very poisonous things in the garage that go in cars, you know, car additives, gasoline, things like that.
And jars of liquid that aren't even labeled sometimes,
yes.
I think, in a lot of people's
And that's another very important thing, is always keep everything in its original container. Don't take it out of a container. People now are buying a lot of products in big, you know, like at Costco, Walmart, the big box stores, and putting them in smaller containers because they're easier to handle. That's really a dangerous thing to do. We get calls every single day about children drinking cleaners, and even worse, because things were put into a container that wasn't the original one.
Yeah. For young folks out there who might be watching this, what would you say to them, one of the most important things about chemicals in general?
The most important thing is to always ask first before you eat or drink anything. I mean, I do a lot of poison prevention programs to children, and that's the one thing we say, is always ask first. And that's also, I mean, we have adults who will drink bleach or things like that have been putting glasses on a kitchen table thinking that it's, you know, a soft drink or something. So, you know, really ask first is the most important rule.
Great. Josephine Darwin, thank you so much for your time from Tennessee Poison Center. We appreciate it. Did you know that just one deceased donor can save up to 8 lives through organ donation and through tissue donation? Enhance the lives of another 50 or more people? Organs that can be donated after death are the heart, liver, kidneys, lungs, pancreas, and small intestines. Tissues include corneas, skin, veins, heart valves, tendons, ligaments, and bones, with the cornea being the most commonly transplanted tissue. More than 40,000 corneal transplants take place in the U.S. each year. To learn more about organ donation or register to be a donor, visit donatelifetn.org. Welcome back, everyone. I'm not sure if you realize, but every 10 minutes, someone signs up who is in need of an organ. Are you a donor? Well, after watching today's program, you may want to consider it, and we'll tell you how to go about doing that. We're going to be talking about that in this segment right now. Joining me is Dawn Benjamin, who's the Senior Public Educator Coordinator for Tennessee Donor Services. And also we have Lee Luster and Daryl Knight, who have a special story they're going to be talking about here in just a moment. But first, we want to put our attention to Dawn, and just, if you wouldn't mind, Dawn, tell us a little bit about organ donation.
Well, it's a very timely topic. Right now we estimate that most of us, probably 1 in 3, is going to have a connection at some point because there are so many more people who require a life-saving organ transplant. So it is a very important subject to talk with our families, and we'll get into that a little bit more about some of the other statistics that we have. But it is a topic, like I said, probably 1 in 3 of us will have a connection with a friend or family member who is in that situation.
Dawn, can you tell us who is eligible to be an organ donor for folks out there who might be interested?
Potentially anyone, when they pass away, could be an organ donor. We always tell people when they're considering documenting their decision, don't rule yourself out because of a health condition or age. You know, any age could be a donor. It's all about the health of the person and the health of each organ. Best example of that is with the liver. We have cases in our service area where people were in their 90s, they passed away, and they were still able to pass on that gift of life because they had a healthy liver. So you never know what you might be able to give.
And speaking of that, we have a lot of organs in our body. So specifically talk about which ones are able to be recovered for transplant.
Okay, there are actually 8. We have the heart, the lungs, the liver, the pancreas, the kidneys, and the small intestine. Those are the organs that you can donate.
Very good. All right. Well, I'm going to go ahead and reintroduce you again, of course, to Lee Luster and Daryl Knight. These gentlemen made the trip today because they're going to talk about their special circumstance. Daryl, here, you had kind of a medical issue, Daryl. This was years ago when you were in the military, and you took medical leave because of that. Talk a little bit about what your health was like prior to your kidney transplant, which is what you had.
Prior to it, it just was a lot of draining, mostly energy. I love to travel and go home. I'm from Florida. Just couldn't do it anymore. Just couldn't. It was a lot of planning. You had to make sure that end, we're going to accept you. You had to make sure this end is sending you. You had to go on certain dates. So a lot of things, it was like, to me, was hindering the family. Because we've been in Florida, we had to go to Disney this day, but I had to go to Dallas with the tickets for this day, so I didn't go. And a lot of energy I just wasn't getting. I kept working. After work, I go to dialysis, and for about the next 20 hours, I was no good. Even going to work the next day, then you kick in and get a lot of energy. Then it drains again, then you're back on dialysis.
Yeah.
And
Well, you went through a lot, Daryl, given your, medical condition. How long did it take you to get the transplant? And talk about how you kind of, then talked with Lee, because you all are friends, correct?
yes, well, I was a friend with his daughter, Rebecca. I was supervising her at the sheriff's office, and I guess it came about it just out of the blue. To tell you the truth, I was giving up coming back to work. I just came back to work. I'd been out 6 weeks because they had to take a kidney out. They took me off the transplant list. I was upset. And a week after I went back to work, I got the transplant. And Rebecca called me. And I just really didn't know how to take it. I'm like, she's gonna lose her brother, and I'm gonna get his kidney. I didn't know how to take that. I didn't know what to do, and I talked to my doctor, and I talked to her, and I no, it's okay. Our family want to do it. We think you're going to take care of it. We know you will, which I do. And they warned me that, so I was all happy. And they said, now, it might not be a match. It's going to be like shooting in the dark. But it was a match, perfect match.
And that's the thing that we need to tell people about. I mean, you have to make sure that you are that perfect match. And Daryl, you worked with Rebecca Lee, that is your daughter, and I'm very sorry you lost your son. That is, though, the gift that you were able to give to Daryl. Tell us how you all went about making this decision.
It's a real long story, but to make the long story short, my son Adam was 31 years old, and he had a major brain hemorrhage. He was at our house that night. We thought he went to sleep, but he didn't. And so we called 911. They came and took him to the hospital immediately. And the EMT men thought he had had a stroke. When we got to the emergency room, a doctor was walking out and he said, we've already done a scan. It's the largest brain hemorrhage I've ever seen. So the surgeon came in. He said if Adam were 50 or 60, we probably wouldn't even try, but he's 31, we've got to give it a shot. So they went in surgery and took the clot out, and the doctor wasn't happy with the way the brain reacted. He said, just wait 48 hours, see if there's any change. Of course, he was on a respirator, and he never regained consciousness at all. And so we waited 48 hours praying for a miracle, and a miracle didn't happen. So we didn't want Adam to be on a ventilator or a respirator forever. We couldn't see that. And they had already done some tests and saw that he could not breathe on his own. He wasn't brain dead, but he was still breathing, but only with the help of the respirator. So we asked about organ donation and got in touch with Family Tennessee Donor Services, met with them twice. They answered all of our questions that we had. And we also found out then that in Tennessee, you can designate who you'd like to receive certain organs. And if they match, which is a long shot, like Daryl said, then they would get them regardless of where they are on the list. They have to be on the list.
Wow.
But regardless of where they are, if it's a match, they get them. So my daughter Rebecca had worked with Daryl for years and said he's not in good shape at all. He needs a kidney. Let's give it a shot. My wife and I had a friend and his wife and family up in Indiana, outside Indianapolis, and his name is Mark, same age as Daryl. He had been on dialysis at home at night for 11.5 hours every night for 5 years straight.
So you were able to...
We designated him.
Yeah, give it to him.
They were both perfect matches.
And that is pretty unbelievable.
That's what I'm told.
You all, obviously, you were friends before, but what a special bond you share. And again, I'm very sorry for your loss, Lee. And you mentioned you were hoping for a miracle, and in some ways, Daryl kind of received that miracle because, and you can speak to this, Dawn, not everybody's ever going to be a perfect match, and some people wait on that transplant list because they don't receive that kind of news.
Yeah, this is an exceptional story. I mean, I have no idea. We were talking about before the program what the odds would be that one, even two people would be matches for someone that you designate that you want to see if they're a match. you know. So just a wonderful story. And I think from their story too, we see, you know, a lot of times in the news we see stories about recipients and how their life was saved, and that's wonderful. But we don't a lot of times hear from the donor's perspective and how important that is for the family left behind, that their loved one was able to leave that legacy behind, that something positive came from a tragedy.
Absolutely, and in this scenario, that's exactly the case. And Lee, just as you said, you were able to help more than just one friend. You were able to help another as well.
Plus other people too that we don't know who they were. There were other organs and tissue and so forth taken. Just a sidelight, Mark, the other receiver in Indiana, his brother-in-law passed away suddenly this summer, over 3 years after it, and he wanted to be an organ donor. We went to his memorial service, and I met with the man at Indiana Donor Services, and he advised us that his donation had either saved or improved 78 different people.
Wow. So, I mean, that right there will tell everybody the difference that you can make. Tell us, Dawn, how people can register for those folks who are interested or have not done so.
Well, it's very simple for Tennessee. We have the Tennessee Donor Registry. The easiest way to do it is when you're at the DMV. On your application, it asks you if you want to be an organ donor. If you check yes, your name goes on to the registry, which is simply a database. Today in the state of Tennessee, it is a legal form of consent. So you are directing people as to what you want to have happen after you pass away. We always encourage people to tell their families, talk to them about this, find out each other's wishes. None of us want to be faced with this question at a very tragic time, not knowing what our loved one would have wanted.
Absolutely.
People can also go to our website, donatelifetn.org. That's the registry website. It's not necessary to wait to go to the DMV. You could do that today.
That's right. And Daryl, I'm going to let you have the last word, sir. If you could tell folks out there the importance of registering, just because of what you've experienced.
I think the important to register. I registered once I got to the military. That's the first time I thought about it. And the important, I mean, people sit there, you save so many lives, not just the person that get the organ, but you have to think about their families. Then you have to think about, I mean, the friends, things that person is doing. And I think society as a whole, when we don't donate organs, and I think especially minorities, African Americans, don't want to donate. And we ask, I asked a lot of people, and you know, about donate, not
sure.
Give me something. No, they're afraid.
Yeah.
People are afraid. I'm like, they need to do some homework on it. But I know that. I mean, it worked. It saved not only that person, but it saved the whole family.
That's right. And just as you all are the perfect example of that, and the gift that you've given each other, more or less.
Yes.
Thank you all so much for taking the time, Daryl and Lee, to share your personal story. We really appreciate it. Dawn, thank you so much for the information.
Thank you.
Folks out there, I hope you are able to take the time and reevaluate your life and hopefully sign up to be a donor yourself. Did you know quitting smoking has major and immediate health benefits for men and women of all ages? No matter how old you are or how long you've smoked, quitting can help you live longer and be healthier. People who stop smoking before age 50 cut their risk of dying in the next 15 years in half compared with those who keep smoking. Ex-smokers enjoy a higher quality of life. They have fewer illnesses like colds and the flu, lower rates of bronchitis and pneumonia, and feel healthier than people who still smoke. If you're ready to quit, call the Tennessee Tobacco Quit line at 1-800-QUIT-NOW. Are you someone who has tried to quit smoking, but you really haven't had a whole lot of success? Well, maybe you're just not ready. And this lady right here sitting with me knows that very well. Marcella Bianco is the Tobacco Prevention Program Director with the Tennessee Department of Health. We really appreciate your time today,
Thank you.
Marcella. I say that you know that because you told me that when people don't have luck in quitting smoking, that is one of the key things. They just may not be ready to do so.
Correct.
You work, I know, a lot with statistics. You know how many people here in the state smoke, and it's still a big statistic, a big number.
It is. Yes, we the state of Tennessee is 24.3% smoke adults.
Wow.
And that's just cigarettes. That's not including ends, electronic nicotine, and nothing of that. It's just regular cigarettes.
How do we compare nationally?
Out of the 50 states, we are number 46. So
So
we
we've
have
got some work to do.
a lot of room for improvement.
That's right.
Yes.
The state, though, is taking some steps to make that happen, though, to help folks out there who are trying to do so, right?
Yes, we are. We just last month kicked off It's Quitting Time in Tennessee, which is it was a whole week-long promotion to promote cessation services. We have a free tobacco quit line. There's information and help out there free for those who are ready to quit.
So many people hear so often, you know, how smoking is bad for you, but talk specifically about health complications someone might endure if they continue to smoke.
There's so many, and we can go from the cancers, the lung cancers, COPD, and you can go to the little things like it can ruin your teeth. Your skin loses the elasticity and changes color. You know, you have a smell. Your fingers can actually turn a little yellowish with your fingernails. If you look at some smokers who've been smoking for a long time, you can see around their mouth, it's the little wrinkly from the puff. So it goes from the big things like cancer, where it's going to change your life, to just the daily little things, smell and taste. You know, some of the people who we've helped quit, they're like, I can actually taste my food now. And they think that, well, I don't want to, some of them say, I don't want to gain weight, so I don't necessarily want to quit. I'm going to eat all the time. It's like, well, you can taste your food. That's why you tend to eat a lot more.
I see, yeah. You know, a lot of people who actually smoke, I mean, you know, not everybody deals with the secondhand smoke, because now there's actually laws in place to where you would go to a public place and you don't necessarily, you can't smoke in those places. But some people are still exposed to secondhand smoke. Where would some other places be that people would still have to smell it?
Parks, outdoor places. I mean, we have some voluntary outdoor places that are tobacco free. In your home, in your car. Your clothing, which is the third-hand smoke, the second-hand, third-hand smoke. So if you have a brand new baby and someone, even if you didn't smoke, but say I had a cigarette and I smell like smoke and I'm holding your baby, that baby's inhaling that third-hand smoke from your clothing.
And it still poses a risk, obviously.
It does pose a risk, yes. Their carcinogens are still in second-hand and third-hand smoke. It's called involuntary tobacco smoke because I'm breathing it in involuntarily. I'm not doing it because I'm taking the actual cigarette. It contains over 7,000 chemicals still just in the smoke that's been emitted.
Wow.
So to say that it's not harmful, it is harmful. It actually increases chances of lung cancer by inhaling secondhand smoke. And there's lots of cases and people who have lung cancer because of secondhand smoke.
You know, it's so easy when you hear things like that to tell people, well, just don't do it. But you know, that's hard. I mean, it's so easy to say, well, just quit.
Right.
But there are people who have smoked for years, I mean, a lifetime. So if somebody finally says, all right, I'm ready to do this, you know, because as we said in the very beginning of this program, you're not ready if you're not having success.
Right.
What is their first step?
Call their doctor. Talk to your physician. That's our biggest request, is that you talk to your physician, find out what type of therapy is out there for you that you can take. There's numerous different types of nicotine replacement therapy, but don't go take the patch if you don't know you're healthy enough to go take the patch. So we really want you to go talk to your doctor first. Then there's several other steps. You ask for family and friends for help, especially if you're trying to quit smoking and you have someone in your house that smokes, or your friends, your social group that you hang out with uses tobacco. Say, you know, I'm trying to quit, can you please help me? So seek help from others as well. We do have free services, like I mentioned before. We have the tobacco-free quit line that they can call for free and get help and get guidebooks, get free nicotine replacement therapy for 2 weeks if they're eligible from their doctor to receive it.
Tell people also, you had mentioned some of the ways that they can try to quit, whether it be gum, patches, having that consultation with your doctor is important. Some people go, though, from smoking tobacco to all of a sudden e-cigarettes. For folks out there who don't know what that is, or vaping, explain what that is and then tell us, is that better?
Right.
But define it kind of, if you will, or let us know what it is.
Right.
First.
It's a liquid vial, per se, that you get, and it ignites it with a battery. So it's a battery powered. So it's not combustible. You're not using a match to light it. But it does ignite because it's got a battery power in it. So is it better? No. There's still laws out there where people can use electronic nicotine devices. That's what the actual word is. We, in the industry, our term is ENDS, is what we call it. The vaporizing vapor, that's industry term. There's up to 3,000 chemicals in one little vial. We don't know what they are.
Oh, goodness.
They're not FDA regulated. So, and when you go into you can go into a vape shop. We actually call it aerosol because that's what's coming out because it's a chemical that comes out. But if you go into a vape shop, they'll welcome you and they'll say, you know, oh, what type of tobacco products do you use? You say, oh, I use XYZ brand. Oh, well, do you like a particular flavor? And they'll be like, oh, sure, we like, you know, bubble gum or grape or something like that. They'll go in the back and mix up the ingredient for you and have you try it so it can taste just like what you're already using.
Wow.
Now, the flavors are more for the kids than the adults, but it is reaching that college age group as well with the flavors.
Yeah.
So if you just want your regular XYZ brand of tobacco product, they can go in the back and mix it up to match it for you.
Yeah. Well, see, as a mom, that sounds scary to me. So it's like, I don't, you know, I would hope that people would be aware of what's actually going on. And folks like you being able to educate people to let them know this exists, this is happening. Doesn't sound good.
Right.
When we're talking though about smoking though, Marcella, there are other forms of tobacco use, obviously, that people, you know, are using. So all forms of tobacco is basically what you guys are preaching, just don't do it.
Right.
And we're talking...
There's smokeless tobacco, which is spit tobacco. Some other types of tobacco that you may not be aware of are orbs, which look like little Tic Tacs. There are sticks, which look like cinnamon sticks. They're like those thin coffee sticks that you can use, but it's actually a tobacco product. And all of them contain nicotine, plus other chemicals. Some we know, some we don't know, because they're not FDA regulated, so we don't know what's in them all. But they all contain nicotine, which is the addictive drug.
That's what you have to remember.
Yes.
Yeah. All right. So much to learn about smoking and so much, you know, help that you can get. We know through the Department of Health you can as well. And we appreciate your time today, Marcella.
Thank you.
This is going to be one of those conversations I think that we continue to have. But hopefully our numbers continue to go down and not up. And the state seems like it's making a lot of progress with getting the word out. So thank you so much for your time again, Marcella Bianco, Tobacco Prevention Program Director with the Tennessee Department of Health. Thank you. And thank you all for watching Community Health Matters.